Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're sitting down with one Low Country bariatric surgeon to learn the facts about obesity.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Washington. He's a bariatric surgeon here at East Cooper Medical Center. Thanks for being with us today.
Thank you.
Okay, so today we're talking about, first off, let's talk about body mass index. What is it?
Well, body mass index takes your weight in relation to your height, because weight alone doesn't mean anything. If you have a 7-foot tall person and they're 250 pounds, they probably have a perfect body mass index. But if that same person is 5 foot tall and 235 pounds, they're severely overweight. So it's an index that takes your weight and your height into consideration.
Okay, weight and height. So has it changed over the years, or is it like what we consider to be obese?
No, no, it hasn't changed over the years. And basically, you can easily, if you go into the math, it's your weight in kilograms divided by your height in meters squared, but you don't have to do any kind of calculations because we have what we call body mass index charts. Mm-hmm. And if you look up your weight, like let's say I'm 187 and I'm 5 foot, roughly about 5'10". So my body mass index right here is probably about 28. Okay, which puts me in the slightly overweight category.
Okay, just slightly.
Yeah, slightly overweight.
Okay, so what would you tell a patient who was in that area?
In the slightly overweight category, we would just say, diet, exercise, watch what you eat, and try not to go into the obese category, which starts at a BMI of 30, and really try not to get into severely obese category, which starts at a BMI of 35. And what we call morbidly obese, which starts at a BMI of 40.
Okay, real quick, does that mean that, let's say, 18.5% of your body is fat? Is that how it?
No.
No, okay, why?
It's an index.
Index, okay. Because that's what I have always thought it was.
Right, body mass index is basically your height in relation, your weight in relation to your height. Now you're talking about body composition.
Gotcha.
And body composition is also important, because bodybuilders who have a lot of muscle can have a body mass index of 50, yet they're not obese because it's all muscle. Gotcha. So you have to take into account with your body mass index what your body composition is also.
Perfect. Okay, let's move on to set point theory. I've never heard about that. What is it?
Yes, well, set point theory, in the past we looked at obesity as willpower, lack of willpower. If you went to your doctor, you always prescribed diet and exercise as the main treatments. And now we know that, obesity is disease, and it's not, really a lack of willpower. It's more that obese patients have what we call an elevated set point. And they have an elevated set point for many reasons. We believe that our environment has something to do with it, genetics, medications, sleep patterns, our industrialized society. But it raises your set point. And your body, when you try to lose weight, your body tenaciously tries to get back to that set point. Okay. So if you gain weight and you do diet and exercise to reduce your weight, your hormone levels adjust in your body, okay, which causes you to, it increases your appetite, it slows your metabolism, which causes you to regain the weight. So your body actually fights against you. People make the analogy, it's like having a thermostat that's set too high in a room. So the thermostat is set too high and you're hot. So you open the windows and the room cools off, and then you shut the windows and the room turns back to what the thermostat was set at. So that is the new theory as to why people have elevated weight, that certain individuals that are obese have an elevated set point. It's no longer thought of as a matter of willpower.
Okay, that's very, very interesting. So we need to look at this in a positive way, right? Because it's not like it's going to be a never-ending circle of you're going to always keep coming back to weight gain, right? You eat that piece of bread and it's done, right?
Well, what we're saying is that we know that diet and exercise, are only 5% successful in most people that are severely overweight.
5%?
5%. Although there's a lot of different, diets out here, and you see them, you're bombarded with them every day.
It's changing literally every day.
You're right. All of them taken together, long-term, have a 5% success rate. And that's because of set point. Most people can, even my patients can lose weight. But to keep it off long-term, for the rest of their lives is the problem.
Okay, so real quick, how do you know what a person's set point is? Is it like is it a number? Is it a...
No, what I'm saying is, the body tenaciously tries to defend its set point. So let's say you're 300 pounds. That's an elevated set point. Okay, let's say you're, 5'8", 300 pounds, and your body mass index, let's say, is around, 45. If your set point is 300 pounds, all right? And if you go and try diet and exercise, you probably could lose 50 pounds, 60 pounds, and it will take a lot of willpower. But your body, the hormones in your body change, particularly a hormone called ghrelin, which is responsible for your appetite, in doubles or triples. So you're even more hungry than you were at 300 pounds. And then your body's metabolism slows down, okay, which causes you not to burn as many calories, thus bringing you back to that set point of 300 pounds.
Gotcha. Okay, I understand that now. Okay, so what do we do about it?
Well, there's the only thing that has shown consistent long-term success as far as weight loss in people that are severely overweight has been bariatric surgery. Because bariatric surgery is the only thing we have today that actually changes your set point.
From the moment you get the surgery?
From the moment you get the surgery, it changes your set point. But diet and exercise don't change your set point. And your hormones readjust and your body tries to come back to that 300 pounds, just like the thermostat that is set too high. But bariatric surgery actually sets that thermostat lower.
That is a great explanation. I've learned a lot today, but before we go, what else do the folks at home need to know? You're new to the area, right?
Yeah, I'm new to the area. East Cooper Medical Center has started a bariatric program to serve the residents here in Mount Pleasant. We are just getting started, but we feel that there's a real need in the community as we don't have a bariatric surgery program in Mount Pleasant. And I'm the director of that program, and we're seeing patients now.
All righty, well, thanks again, Dr. Washington, for having us. And for more information, head online to eastcoopermedctr.com.